Good morning, everyone. Good morning. We will get this started. Thank you all for joining us today. I am Senator Mark Leno, and standing here with many of my colleagues who have graciously joined me in co-authoring SB 810, which is the latest incarnation of SB 840. We are standing on the shoulders of Senator Sheila Kuehl, who sends her regards this morning, and all of those who have been working so many, not years, decades, to get to the goal of single-payer universal health care reform. And I would like to recognize my colleagues with me today, Assemblywoman Mariko Yamada and Senator Lonnie Hancock. We have Assemblyman Tom Amiano and Assemblyman Wes Chesbrough, Assemblyman Dave Jones, and Assemblyman Sandre Swanson, Assemblyman Jared Huffman. And I know that there are many others who have joined us as co-authors. In fact, we have 43 co-authors upon introduction of the bill. And I suspect that number will top 50 as the year unfolds. No news to anybody. We are in the midst of a very severe health care crisis in this country. Thank goodness we have a president now who has recognized that, as nearly 50 million Americans are without health care coverage. Here in California, that number is approaching 7 million, nearly a million of them children. We dare say that our health care system is broken. In fact, I would say that we don't have a health care system. We have a risk management system. That's what we do in this country. We aren't concerned about the health and well-being of our citizens. It's all based on risk management, and it's not about whether we're risking ill health or not. It's the risk of the bottom line of the insurance industry. In fact, in insurance industry speak, healthcare provision is literally regarded as medical loss. That is how they refer to our health care. So the deeper I get into this subject, and just very briefly, the bill is nearly identical to 840. We didn't have the opportunity to choose the number 840 this year because we're limiting our bill introductions on the Senate side, and we didn't get to 840. We got to 810, though, and so that's how the bill will be known. But the deeper I get into the subject matter, the more wholeheartedly convinced I am that single payer is the way to reach universal health care coverage. And I make reference to a study and report issued by the Lucille Packard Hospital Foundation a few years ago. And they looked at the top 21 industrialized nations of the world. They looked at cost of health care and access to health care, quality of health care outcomes, life expectancy rates, and infant mortality rates. And the United States ranked 21 out of 21 nations across the board in all of those metrics. If that weren't bad enough, we pay twice per capita to rank at the bottom of the bottom. So there is certainly enough money in the system to provide not only universal health care, but quality and accessible health care, should we decide to make that our goal rather than risk management. Healthcare costs are completely uncontained and uncontrolled at this time. And that's not only costing you and me and every Californian excessive amounts of money, but it's also costing our state and county governments excessive amounts of money. We, of course, as a state, pay for the premiums for public employees, our firefighters, our teachers, and others. We also, of course, pay for the health care that the insurance industry won't pay for, and that is the most expensive health care, caring for the aged and the infirm and the indigent. Now, health care costs are growing at about 4 times the rate of the growth of our economy. And how we pay for all of that health care at the state, of course, is through taxes, which is directly linked to the growth of the economy. So this is an equation that is set up to be unsustainable, costs growing 4 times greater than the revenue we have to pay for those costs. And until we contain those costs, we're only going to dig ourselves deeper and deeper into a hole, and we see the impacts of that on our attempts to balance our budget each year. So the other thing that those 20 nations have in common that we don't is some form of single-payer universal health care. And so we need to shift paradigms completely, because as long as we're in the situation, I compare it not unlike the situation we have with our banking industry that we've all seen unfold over the past year. I think this is the first-year anniversary of the fall of Bear Stearns. That private industry will take all of the profits, thank you, but we, the public, will take all of the risk. And that's the way it's set up. So they will slice and dice us into old and young, well and less well, with different pre-existing conditions by gender, by income, by employability, and then the industry will decide who they will insure, and we get all the rest. They'll take the profit, we get all the risk and the cost. And so that's where we are right now. So we will move this bill forward, and I would imagine any number of you here today will say, is this just a drill? Is this just some sort of exercise? The governor's vetoed this bill twice already. Why are you doing this? Well, as we envision this, this is not just a piece of legislation. This is not just an idea. This is probably one of the fastest growing social movements in California. There are activists not only in this room, and I want to recognize Assemblyman Tom Amiano as the author of Healthy San Francisco, which is set up a structure so that every San Franciscan will have health care provision, not coverage, but provision. He said it. I didn't. Thank you, Tom. Okay. And now he's out of the room.
Might as well just shut it down right now, Mark.
On that note, yes.
And we also have a couple of our other co-authors on the bill, Senator Dean Flores and Senator Pat Wiggins. Thank you for joining us as well. And Assemblyman Jim Bell. The list keeps growing. The list keeps growing. Where was I? Where was I? So I just want to say that this is a growing social movement, and we intend to keep the debate alive through the fact of our bill. There will be press conferences, there will be press opportunities, there will be news stories, there will be recounting of the ever-growing number of Californians who are either going bankrupt because they cannot pay for their health care costs, or they are losing their health care, or they are dying of preventable diseases. All of the horror stories that are all too human and all too painful will be hand in hand with the moving forward of our bill. We do imagine to get it to the governor's desk, probably with an ever-growing majority of legislators voting for it in both houses. Whether we put it on the governor's desk this year or in the second year of the two-year session, we would not be surprised if he vetoed it a second time. But we will then work hard and focus our energies on electing a governor in 2010 who will sign our bill into law in 2011.
Yes.
As we prepare for the expected referendum in 2012, where the industry will try to overturn that which the new governor and legislator have created. And it is our job to work from this day until that ballot date in 2012 to better educate Californians as to what single payer is and is not. Clearly, the governor did not understand what it was when he vetoed it, because in his veto message he said he could not sign it because it is socialized medicine. Well, socialization is not an ugly word in Washington, D.C. these days, but single payer is not socialized medicine. Healthcare provided in the private sector remains in the private sector. Your doctor doesn't change, your hospital doesn't change, your clinic doesn't change. Healthcare provided in the public sector stays in the public sector. What changes is the paying entity. There are currently over 6,000 health payers in California today. So if you provide me healthcare and you want to get paid, you could be dealing with thousands of different forms, hoops, and hurdles just to get yourself paid, and that's eating up about a third of our healthcare dollar, wasted not on healthcare provision, but just on healthcare administration. We think it makes much more sense just to have a single payer, and that would be the state, and put all of those tens of billions of dollars of administrative waste into savings to cover all of those who are not currently covered. In addition to that, there are also billions of dollars to be saved in the bulk purchasing of pharmaceuticals and medical durable medical equipment such as wheelchairs and prosthetics and eyeglasses and hearing aids. All of that will save us additional billions. And of course, also, rather than wasting money on actuaries and claims adjusters and utilization reviewers who overturn medical decisions as to what's good for a patient, put all of that into preventive care and primary care. Additional billions to be saved there. So we know this can be done. We don't have to have a system that's based on risk management. We can have a system that's based on making sure that every Californian has a healthy start and a healthy life. And that is the purpose of our efforts here.